You've tried stretching, you've tried rest, and you've tried medication, and yet that pesky one-sided lower back pain continues to pop up time and time again. So in this video, let's figure out what it is and exactly where it's coming from and exactly the activities you need to do to resolve that pain once and for all. Those symptoms of pain and irritation are a clue. Your body is trying to tell you that something is going on, and I want to help you decode that language. There are three main culprits that really cause that single-sided lower back, mid-back pain points. And those are the costovertebral joint, which is where the ribs attach to the thoracic spine, the lumbar facet joints, which are the smaller joints in the lumbar spine that kind of make an angle here and help us to have greater stability in the lumbar spine, and then the sneaky little Quadratus lumborum. And we're gonna find that guy and tease out which one of these pain points you have so we can dial in the interventions for you. So we're gonna run a few simple tests from the comfort of your own home to determine exactly what tissues are being irritated and then jump right into the interventions so that you can feel better in the next 10 minutes. Hey, I'm Dr. Nick. I'm a doctor of physical therapy and functional movement therapist, and I believe in the body's ability to heal and the body's ability to heal from back pain naturally. So if you're on board with that, go ahead and smash that subscribe button and let's get started. And all you need to do these tests is a little bit of space and a little bit of time from the comfort of your own home so we can figure out what's going on. Okay, so first we're gonna look at that costovertebral joint. We wanna see if the rib junction, where it comes through the ribs here towards the lower back and mid back, if that's the pain point right there. And we're gonna confirm that by giving ourselves, trying to keep the belly button and lower abdomen steady, but can we get the ribs to rotate? And as you rotate into that section, does that create pain? If so, then that's a yes, and let's hold on to that. If not, take it to the next step here, and we're gonna rotate and then side bend backwards into it, kind of coming down onto that specific area. And you can really target that by just rotating from a little bit lower in the rib cage as you come into that side bend. If that's your pain, then let's go ahead and earmark it, and we've got some costovertebral symptoms. If not, we're gonna go on to the next test, which is for our lumbar facet joints. And what we're gonna do here is we're gonna take our thumbs right in that pain point. If it's kind of a little bit lower or could be here in this middle section, we wanna kind of C-shape our hand right around that painful area. Feet nice and wide here, about shoulder width apart. And we're gonna come back into the side into that joint. And typically that will light us up right there as we dip that shoulder in. Is that a yes for you? And thirdly, for that Quadratus lumborum, we typically have a little bit of discomfort if you follow the hip and we come right up over the hip there. There can be a little bit of tension in between the hip and the ribs, which is where that QL runs, right in that section there. And we may find a bit of discomfort if we hike that hip. And then also, if we drop that hip just a smidge and feel that little bit of contraction there, either way, do you have pain there? For our costovertebral symptoms, we're gonna work into rotation. And we wanna work rotation into both directions. Now, when we rotate, our ribs need to rise, not fall and sink. So make sure that we cross our arms. Sometimes it helps to hold onto a stick or a pole here, just to make sure we're not protracting the shoulders. We want to stay nice and steady. And then as we rotate, we're going to lightly elevate from the bottom ribs there, keeping our nose in line with the sternum and then coming back through. Bonus points if you can get a little breath in there. So try not to hold your breath. Make sure we're moving through that pain-free range. It's okay to get a little bit of rotation from the lower body, but you're really focusing on those ribs, especially where that pain point was, right? So just taking yourself through your pain-free range and find that repetition. So for our facet joint pain, we can do this standing or we can do this laying down. But what we'll do is we'll get against a firm surface, floor, bed, wall, whatever that may be. Keep those knees lightly bent, hands around the hips, and we're gonna allow the pelvis to tilt forward and allow the pelvis to tilt back. This is called a pelvic tilt, and we can do this in quite a few different positions. I'm gonna show you in quadruped next, so that we can get those lower facet joints, lower lumbar spine joints moving. And a little bit of a pro tip is if we control that pelvis, we can control the lumbar spine. So You can create more lordosis or more curve in the lower back or less lordosis by simply rolling that pelvis back and forth. But the other thing that we're doing here is we're desensitizing those painful joints, improving the lubrication, improving the blood flow, improving the oxygenation, but really allowing yourself to move through your pain-free range. Go towards stretch and give yourself a little bit of time. Find 5, 10, 15 repetitions, what feels good to you, and push into that point of stretch, allowing the range of motion to simply open up with time and repetitions. If you need to come to a quadruped position, you can do that as well. So all fours here, nice straight spine. Pelvis wants to rotate then forwards and backwards. So similar to a cat-cow position, but we're just gonna focus on that pelvis and being able to control the movement there naturally. So both hands under, I just wanted to show you kind of where that pelvis is moving from. A lot of people struggle with this because when we're on our back and working in kind of a supine, a bent knee position here on your back, they'll try to pull the belly button in to control the pelvis or push with the legs to get the pelvis to roll backwards. But when you have full control of that pelvis, it's going to work from your actual pelvic muscles. So we're feeling that across the really lower abdomen and into the pelvis there, not necessarily changing the pressure or position of my abdomen. So here with our thoracic windmill, we're going to rotate from the ribs to try to reach and create a big circle in this horizontal plane. So it's going to look a little something like this. We're going to reach forward, get those ribs to stretch out forward, come up to 12 o'clock. At 12 o'clock, I'm going to turn my hand to palm up so that I can open my chest and ribs, get that big stretch there, and then coming on down at 6 o'clock, right down here, I'm going to turn my palm back to flat and palm down so that I can go back through, okay? Reach, pull, all the way up to the top, palm up, rotate back, breathe in. Great big stretch. So good. Enjoy that one. And for our QL, we're going to work into what are called wig wags. It's kind of a funny name, but I love it. So we want that pelvis to drop and then rise. And you're going to try to contract that QL muscle by raising the pelvis and then just a little bit of length and stretching the pelvis. This can also be good for Facet syndrome as well as a little bit of an adjunct treatment. And all of these kind of go together in all honesty, which is why I group them together for you. So go through a couple sets of 10 through your pain-free range, getting that contraction here with the wigwag, but enjoying that motion, getting some nice breath in, feeling your mobility open up, and then let us know in the comments how you feel. And then to actively work your QL, we're going to do some hip hikes. So we're going to drive that pelvis up and then let it fall back down again. So we just did it in an unloaded and then loaded position. Try to keep the stance knee unlocked. I like to come to the toe, just kind of staggered off to the side here. Holding the pelvis here helps. And then squeezing that QL as you drive your hip up and then coming on down. Remember to take yourself through full range of motion. So if you have a step or stair that's available, you can hold on to the rail and get your pelvis to make that full range of motion. That tends to be the best result rather than coming back to flat. I always like to take the joints through full range of motion and the muscles through full range of motion so you can get the best results possible. So that was a great workout. I hope you guys got a lot of value out of that video. If you have other questions about back pain, one-sided, two-sided, or any of the in between, go ahead and hit me up in the comments below and let me know how I can further support your healing. All right. Otherwise, take care and I'll see you guys on the next video.